Welcome to today's lecture. Today we'll be discussing hypertension. Today we'll be discussing hypertension. Last time we looked at drugs that are used in the treatment of hypertension in pharmacology. Today we'll be looking at hypertension in medicine. So the simple definition for hypertension is just a condition which just a condition in which there is sustained elevation of the arterial blood pressure. It's a condition in which there is sustained elevation of the arterial blood pressure. Systolic of above 140 and diastolic of above 90 millimercury. So when you say somebody has hypertension, you mean the blood pressure is above 140, the systolic, and the diastolic is above 90. Or it's a condition where there's consistent elevation of systolic blood pressure above 140 millimercury and diastolic pressure of 90 millimercury. Classification of hypertension is classified into two: the primary hypertension and secondary hypertension. Primary hypertension is also called as essential hypertension. Primary hypertension is so far the most common type of hypertension, which represents 90 to 95 of all hypertensive stresses. 90 to 95 of all hypertensive stresses. Primary hypertension or essential hypertension is the most common type of hypertension. The cause is idiopathic or it's unknown. The cause is idiopathic or it's unknown. It tends to learn in families. Primary hypertension tends to learn in families. Primary hypertension is further divided into subgroups. There's benign hypertension, which can be present for a long period of time without causing serious problems. There's also malignant hypertension, which has a sudden onset and produce severe symptoms, making survival to a few months or up to 2 years if not properly managed. So there are two under primary hypertension or essential hypertension is subdivided into two. There's benign hypertension and also malignant hypertension. Benign, which may be present for a long period of time without causing serious problems. Malignant, which has sudden onset and produce severe symptoms, making survival to few months up to 2 years not properly managed. Secondary hypertension, it accounts to 5 to 10% of people with hypertension. It accounts to 5 to 10% of all people with hypertension. This means that the hypertension in these individuals in secondary of a specific disorder, particularly the organs of the blood vessels, the kidneys, the adrenal glands, and the aortic arteries. So secondary hypertension, it accounts to 5 to 10%, as we mentioned, and it comes as a result of disorders of the organs, particular organs and blood vessels, such as the kidneys and also the adrenal glands. When you have any effect on the kidneys and the adrenal glands, you tend to have this type of hypertension. Causes of hypertension. The causes of secondary hypertension, we have adrenal gland tumors. So if you have any cancer of the adrenal line, adrenal gland tumor, cancer of the tumor, cancer of the adrenal gland tumor, it can cause hypertension. Severe anxiety and stress can cause secondary hypertension. Best views, endocrine disorders such as Cushing syndrome, diabetes mellitus can cause secondary hypertension. Kidney diseases such as glomerulonephritis, kidney failure, renal artery stenosis, and also renal vesicular obstruction or narrowing can cause secondary hypertension. Obesity can also cause secondary hypertension. Pregnancy can cause secondary hypertension. Renal artery stenosis can cause secondary hypertension. So what usually happens when somebody has hypertension? The kidney disease, if it's causing the kidney. The kidney disease lead to kidney disorders can lead to renal ischemia. Or when somebody has a kidney disease or as a tumor to the adrenal gland, it can lead to ischemia, which in turn leads to activation of renin-angiotensinogen system. When it is activated, it leads to conversion of angiotensinogen to angiotensinogen to angiotensin 1. Angiotensinogen, angiotensin 1, okay, when kidney disorders leads to ischemic, which in turn leads to activation of renin-angiotensinogen system, angiotensin system, which in turn leads to renin-angiotensin system. So when what usually happens is there's any ischemia to the kidneys, it leads to release of renin-angiotensin system, activation of the renin-angiotensin system. So when the renin-angiotensin system is activated, it leads to conversion of angiotensinogen to angiotensin 1. Angiotensin 1 will be converted with the help of angiotensin converting enzyme to angiotensin 2. This will lead to constriction of the blood vessels, leading to um, hypertension. So what usually happens when somebody has hypertension is important in the kidney disorders. If somebody has a kidney disorders, it's going to affect the blood flow. So in that affects the blood flow, there will be ischemia to the kidney. When there's ischemia to the kidneys, it will lead to activation of the renin angiotensin system. So that renin angiotensin system will be activated. When it's activated, it's going to lead to uh, conversion of angiotensinogen to angiotensin 1. Angiotensin 1 will be converted with the help of angiotensin converting enzyme to angiotensin 2. This will lead to constriction of blood vessels leading to hypertension. And also, because of all that, the hormone will be released, causing retention of sodium and water retention, causing circulatory volume, which can also cause hypertension. And also, stenosis of the aorta can also lead to elevation of blood pressure due to narrowing of the aorta at the point of stenosis. Because of the narrowing of the aorta, there will be increase in blood pressure. Also, endocrine disorders such as Cushing syndrome. This causes retention of water, hence elevating the blood pressure. Tumors of the adrenal medulla, which secretes excessive adrenaline causing this constriction of the blood vessel, causing hypertension. Also, base use may lead to release of renin, eventually causing blood pressure. Risk factors of predisposing factors of hypertension: age above 50, female by gender is a predisposing factor to hypertension, history of diabetes is a predisposing factor to hypertension, family history of hypertension. If someone in the family who has hypertension, you're predisposed to have hypertension. Obesity is also a predisposing factor to hypertension. Lifestyle, excessive intake of salt is a predisposing factor for hypertension. Emotional stress is a predisposing factor of hypertension. So, clinical features: uncomplicated high blood pressure usually occurs without any symptoms. So, in an uncomplicated high blood pressure usually occurs without any symptoms, silent. And so, hypertension can be called or labeled as a silent killer. It's because the disease can progress to the final development potential fatal complications, which can fatal complication of hypertension such as heart attack and also stroke. Then uncomplicated hypertension may present and remain unnoticed for years, even decades. This happens when there is no symptoms, and those affected so to undergo periodic pressure screening. So uncomplicated hypertension is very dangerous because it does not show the symptoms. One can stay with it for years without showing the symptoms. That's why it's regarded as a silent killer, because it can even undergo complications leading to a heart attack and also stroke, because it does not show the signs and symptoms. does not show the symptoms of hypertension. It's silent. That's why a person cannot be undergoing periodic uh, screening for blood pressure. Clinical features, some people with uncomplicated hypertension, however, may experience some symptoms such as headache due to cerebral hypoxia, there's dizziness due to cerebral hypoxia, there's shortness of breath due to impaired gaseous exchange, there's impaired vision due to lack of blood vessels supplying to the retina, there's confusion due to damage of the brain, chest pain due to angina, result of myocardial infarction, there's no ear nose due to involvement, there's palpitation due to weight load of the heart, nose breathing due to lack of blood vessels in the nose, the tiredness due to impaired tissue perfusion. Investigations. Some of the investigations you can do when somebody has hypertension is history. We review uh, hypertension in the family. You can also do a full blood, a blood pressure. You discover that it's above 150, the systolic and diastolic 100. You can do a renal function test to rule out renal disease. You can also do can do renal angiogram to rule out renal stenosis. You can do analysis to rule out renal disorders. Treatment of hypertension, you can give antihypertensive drugs such as levodopa, 250 to 500 milligrams CDS for 5 days. You can give ACE inhibitors such as another pill. You can give beta blockers, propranolol or atenolol. Propranolol 20 to 40 milligrams CDS for 5 days. You can give uh, calcium blockers, channel blockers such as nifedipine. You can also give diuretics such as furosemide or Lasix 20 to 40 milligrams. Vasodilators are diazine. You can also give analgesic for pain, 1 gram CDS and enough less. Also restrict the patient on intake. Complications of hypertension. Complications of hypertension, we have hypertensive encephalopathy, congestive heart failure, kidney damage, stroke, vision loss, and also brain damage. Nursing care, the aim is to prevent further complications like stroke, also promote quick recovery and educate the patient about the condition. Those are the aims you can as a nurse. Environment, the patient will be nursed in the stress-free environment to promote less and prevent further elevation of blood pressure. The patient will be nursed at acute care for close observation. The room should have BP checking apparatus for close monitoring of the patient. Rest and activities. Nurse the patient in a quiet room to promote rest. You can press the radio at a low volume to promote rest. Uh, do procedures in block form to promote rest. Also, you can give prescribed analgesics to promote rest. Observations, you do vital signs and BP to act as a baseline data in order to promote it, to know if the condition is improving or not. Observe for dyspnea, if it's present, elevate put the patient in an upright position to allow expansion of the lungs and relieving dyspnea. You do regular BP checks to monitor to monitor the patient's response, psychological care, educate the patient on the disease in order to raise the knowledge level, thereby allaying anxiety. Encourage the patient to ask questions and answer accordingly. Those who you cannot, you can refer to the physician. Explain all procedures to the patient in order to allay anxiety. We offer a bed plan is conformed to best ensure bowel movement, exercise in acute phase. You restrict the patient's activity to promote recovery in condition improve mode, exercise, nutrition. You offer a short feed diet to prevent further elevation of blood pressure. You advise patients to eat food more fruits, vegetables, and fiber to boost the immune system and prevent constipation. Medication, you administer analgesics like paracetamol to relieve headaches. You can also give prescribed and hypertensive drugs in order to promote recovery. Ensure the patients are absorbed the drugs to promote recovery. Self-education, you advise patients to lose weight if overweight, excess weight as explained to the heart intake. In some cases, weight loss may be a treatment if needed. Advise the patient to do exercise regularly, eat healthy diet, less of fat and sodium. Advise the patient to eat fruits, vegetables, and fiber, and also encourage the patient to avoid smoking because smoke uh, tobacco contains nicotine, which plays a role in which can cause vasoconstriction, thereby causing hypertension. If the patient has diabetes, you advise the patient you advise the patient to keep the sugar levels under control. This is where we're going to end from today. If you have any questions, you can contact me.